Hi, I'm William Foster. I'm a junior here at UNCG in the Health Studies program. This is my disease investigation, emphysema. The lung disease emphysema is a condition in which the air sacs of the lungs are damaged and enlarged, causing breathlessness. Emphysema is a long-term and progressive disease. Emphysema, along with chronic bronchitis and asthma, are what is known as COPD, or chronic obstructive pulmonary disease. 4.7 million Americans suffer from emphysema and 15 million suffer from COPD. Causes of emphysema are smoking, tobacco, and environmental air pollutants. The pathogenesis of emphysema seems to be connected with an alpha-1 antitrypsin deficiency, an autosomal codominant condition, but exacerbated by tobacco. Pathophysiology of emphysema includes a hyperinflation of alveoli and destruction of alveolar walls and decrease in lung elasticity. There are 4 types: central lobar, panlobar, panseptal, and irregular. Emphysema and the complications of emphysema are fatal. The complications associated with emphysema are chest infections, pneumonia, pulmonary hypertension, and enlargement of the heart. Treatment of emphysema includes avoiding irritants, stop smoking, pulmonary rehabilitation, breathing techniques, antibiotics, and oxygen. As a last resort, surgical treatment is the final option: lung reduction surgery and lung transplant. The most important thing is to stop smoking or never start.
Pulmonary emphysema occurs when the alveoli in the lungs are gradually destroyed, making breathing progressively more difficult. Emphysema and chronic bronchitis are the 2 most common conditions which make up chronic obstructive pulmonary disease, or COPD. As the condition worsens, the interior walls of the alveoli weaken and deteriorate, creating one larger space instead of many smaller ones. This reduces both the surface area of the lungs and consequently the amount of oxygen reaching the bloodstream. Emphysema also progressively destroys the elastic fibers which keep the bronchioles, small respiratory airways which lead to the alveoli, open. This leads to the collapse of these airways when you exhale, meaning that air in the lungs cannot escape and there's no space for fresh, oxygen-rich air to enter. It is possible to have bad emphysema for many years without noticing any signs or symptoms of it. The main symptom of emphysema is breathlessness, which generally starts to get progressively worse. This shortness of breath does not tend to become a problem until it begins to interfere with everyday tasks. Emphysema ultimately causes difficulty breathing even when you're resting. The principal cause of emphysema is long-term exposure to airborne irritants such as tobacco and marijuana smoke, or air pollution. Risk factors for emphysema include smoking, age, exposure to fumes, dust, etc. People with emphysema are more likely to experience a pulmonary collapse, a condition called pneumothorax, heart problems, and large blisters in the lungs called blebs. Your doctor may recommend a lung X-ray to help confirm the diagnosis and rule out other causes. A computerized tomography scan, a blood analysis, and respiratory tests such as a spirometry test, which measures the volume of air which the lungs can hold. Emphysema has no cure, but treatment can help to alleviate the symptoms and slow its progression. Doctors will commonly prescribe drugs to help you to stop smoking, bronchodilator drugs to help relieve coughing, steroid medications which are inhaled to relieve breathlessness, and antibiotics in the case of a bacterial infection. A pulmonary rehabilitation program can be used to teach breathing exercises and techniques which may help to reduce the shortness of breath. If you have severe emphysema with low oxygen levels in the blood, you may be given extra oxygen to provide relief at home or when you do exercise. Many people need to use oxygen 24 hours a day. It is generally administered through a thin tube which fits to your nostrils. Depending on the severity of the emphysema, your doctor may suggest one or more different types of surgery, including a lung reduction or even a lung transplant. You can take certain measures to slow down its progression and to protect yourself from complications, such as, for example, stopping smoking, avoiding irritants in the air such as car exhaust fumes, paint fumes, some cooking smells, perfumes, candles, or incense, wearing a mask to protect your lungs if you work with chemical vapors or dust, doing regular exercise, and getting the vaccines which help to prevent respiratory infections.